So I just wanted to talk about my own experience with Holocaust survivors over the last 20 years. Um, my involvement with Holocaust survivors started with my own parents, who were survivors from Greece, and not that much is talked about the Greek survivors. Not that many people know about that, but 87% of the Greek Jewish population was lost during World War II. Um, So actually, my work with Holocaust survivors started in my own practice before actually working with the Blue Card, and I can actually trace it back to one couple, um, Barbara and Irving Schweitzer, and they were. This was about 20 years ago, 28 years ago. I just listened to their stories, and this is one of the things I want to mention, that you should listen to their stories if they want to tell you. If they don't want to tell you, fine, but you need to listen. Listening is one of the most important things. So I remember listening to her, and she actually was in the Lord's Ghetto and saw somebody jump out of a burning building. Okay, and they both needed dental care, and I just decided, this is my chance to do a mitzvah, and offered free dental care. And from there, I started working with the Blue Card and seeing many patients and offering free dental care. And I got to listen and hear their stories. I don't know if I was going to talk about that, but I know it's getting late. And okay, the survivor population is dwindling, but there are still a lot of survivors out there. And I actually had a survivor, Dr. Fogelman referred me to me, who had dental implants in her 90s and who played what was it, the mandolin at Lincoln Center. And she passed away last year, but she was 99 years old. So you might think that, survivors, how many survivors are left? It's just not the case. And so it, some of the other survivors that I have seen, they share their nightmares, and the children actually share their nightmares also. So I just have to say that you really should listen to their stories if they want to tell you their stories, and be a mensch. And your staff is very important. My staff is here actually, Maritza, and it's so important. It really is so important that when a patient calls, a survivor calls, they want to be called back. They want to be reassured. I mean, I can't emphasize enough how important that is. You think that it's all being a dentist and a healthcare professional, but it's not the only thing. It's not the only thing. And so some of the survivor stories. I had a survivor who tirelessly fought the German government for reparation. I had a survivor who was told that something must have been wrong with her to survive, as if she was damaged goods. I have to tell you, but our patients have been very kind and appreciative, just to show caring and respect their dignity. And that's what I want to impart for you. I'm not capable anymore of doing free dental work, and so I'm kind of like passing the baton. I'm getting a little older, and I just would like to see that more dentists are doing this, taking care of Holocaust survivors, and even giving free dental care. And I know the Henry Schein is actively involved with this, and so that's my story.
Thank you very much, Dr. Cecil. We hope you have enjoyed our training so far and have hopefully learned a lot about the different person-centered trauma-informed practices to help treat Holocaust survivors. Here are some brief points to help you summarize PCTI. Now, as a healthcare provider, it is important to always have awareness of your clients. Be aware of the large role dentists and doctors played in the Holocaust. And be aware of the fact that your well-intentioned actions and statements may be misconstrued by clients who have not forgotten the actions of the dentists and doctors in the Holocaust. Always be mindful of your clients that may be survivors, and take care in treating and interacting with them. Empower and educate your clients whenever possible. It only takes a few minutes to explain what you are doing, but it does a lot to ease their anxiety. And it also helps them feel more in control of what is happening to them, as if they have a choice, rather than feeling as though this is being forced upon them as happened to them during the Holocaust. Use empathy. Empathetic behavior and comments go a long way towards making your client feel understood, valued, and like their concerns are acknowledged. Listen to your client's verbal and nonverbal language. Some clients may not verbally express discomfort, but may make it clear in their actions or their body language. So it's crucial to be mindful of any client who seems uncomfortable in any way and take a moment to reassure them. Some nonverbal actions that express discomfort include looking away, fidgeting, sitting all the way in the corner of their chair, biting their lip, or even just taking a while to respond. And of course, if they verbally express any feelings of discomfort, make sure you are listening to that and are mindful of that as well. And also, don't just look for signs of their discomfort. Make sure you're also listening to their positive language and mannerisms. It's always good to be mindful of what makes them feel at ease so that you can continue doing or saying the same things that are making them feel more comfortable. Also, remember the importance of patience when working with Holocaust survivors. You might find your clients' reactions to certain events confusing and even frustrating, like if they start to cry because the receptionist tells them that you are unavailable. Just remember that they have been through a traumatic event which changes the way they view things. They might have increased anxiety, a fear of abandonment, anger of what they've experienced, just to name a few. Well, for instance, to you missed their appointment because your other client had an emergency. But to them, once again, they've been abandoned by someone who promised to take care of them, just like their loved ones did during the Holocaust. So just do your best to be patient with them and explain what is happening so that they understand. You can always use your staff meetings and supervision time to vent if you need to, but try your best to show the patient only patience and understanding. And finally, remember that person-centered trauma-informed care begins the second the client pulls up to your office. The first face that they see, usually the receptionist, can have a negative impact on them if they feel that they're being judged or misunderstood in any way. So be sure to train your entire staff in PCTI practices. Thank you all for attending our webinar on person-centered trauma-informed care. We hope you found it insightful and have learned a lot on how to work with Holocaust survivors. This webinar was actually comprised of a few different presentations from another JFNA-sponsored event that the Blue Card held a few months ago. If you would like to view the original event in its entirety, you can download it on our website, which is www.bluecardfund.org. We will also email you the link to the original event and this webinar within the next few days as well. Please also feel free to visit our website if you are interested in learning more about our different volunteer opportunities. And please also feel free to visit the resources listed here for additional information on how to get involved and also to learn more about different dental practices. Now, we are about to begin our questions and answers segment, but before we do, we have a few final poll questions for you.